Good morning, and thank you for joining us for the May 5th COVID-19 Virtual News Conference. My name is Mariah Miracle. I'm a Public Information Officer working in the Humboldt County Joint Information Center, and I'll be moderating today. We'll start by introducing this week's panelists: Humboldt County Health Officer Dr. Ian Hoffman, Behavioral Health Director Emmy Botzler-Rogers, Public Health Director Michelle Stevens, and Family Nurse Practitioner and Humboldt County Vaccine Task Force member Lindsay Mendez. So each participant will now give a brief update on what they've been working on in relation to the COVID-19 pandemic before taking questions. Let's start with Family Nurse Practitioner and Vaccine Task Force member Lindsay Mendez. Lindsay.
Hi, everybody, and thank you for having me here today. I'm just going to give a brief update of what's going on with vaccine clinics in Humboldt County and how you can get your vaccine and some of the barriers that we've been facing this week. First off, I want to remind everybody, if you're looking for an appointment, you can go to MyTurn to see if you can register to get your vaccine this week or today. But on the other side of it, if you're having trouble finding a vaccine appointment on MyTurn, you can also try to go to Vaccine Finder. This is a different website, and it might show you more options, and it will tell you locations where you can get the COVID-19 vaccine, even at other pharmacies. And that's at www.vaccines.gov. Again, it's at www.vaccines.gov. So those are some new changes, and be sure that you can use both resources. The other thing is that we had a little bit of a shipping issue this week with our vaccine, and we are trying to resolve this as rapidly as possible and try to get the vaccine that we were needing for our clinics, including the mobile clinics and the mass vaxes, shipped to our county. Please be patient with us through this very difficult time and transition of trying to get vaccine into our county. The workers on this task force are going to great lengths to get this vaccine here. If you have to reschedule at any time, you can go back onto MyTurn, or you can call the JIC at 441-5000 if you have any questions, if your appointment has been canceled. But if you need your second dose, please, please, please be sure to try to get back on and get that second dose appointment at a different time. There's not a lot to say other than that with allocations, because we have been having difficulty with a shortage of vaccine, but we're hoping to resolve this very quickly and move forward with things like mobile clinic planning. I will touch a little bit on mobile clinic planning right now. We are currently in the Mattole Valley today, and we're going to be in Rio Dell tomorrow doing a clinic. We will be planning with more facilities and more rural areas and outlying communities who might need vaccine in those areas. And stay tuned in the next couple weeks as we work very hard on this team to get more clinics set up in other areas that are not necessarily just in Arcata or Eureka, but in Southern Humboldt and Eastern Humboldt and Northern Humboldt. Thank you so much.
Thanks, Lindsay. Emmy, can you share an update?
Yes. Hi, good morning. Again, my name's Emmy. I'm the Behavioral Health Director here in Humboldt County. I thought I would share a little bit about the services that behavioral health offers, and then also just a bit about the impact of COVID. So behavioral health offers a continuum of services and really supports the entire lifespan. We have children's behavioral health, which serves up to 21-year-olds. We have our transition age youth program and services, which ballparks about 16 to 26-year-olds. And then, of course, we have our adult behavioral health programs and services, and we have an older adult program. Our services include outpatient medication management and support. We have peer support, advocacy, and recovery-based services. And then we have our mobile response teams, our crisis stabilization unit, and our psychiatric health facility. We're also part of a regional model for drug Medi-Cal services, and we offer a range of substance use disorder programs and services. In addition to that, we have a number of fairly integrated programs in partnership with other systems. So for instance, we have Family Wellness Corps, where we partner with child welfare and the tribes. Our older adult programs are co-located with Adult Protective Services and in-home supportive services, and children's behavioral health is co-located with child welfare, and they also work quite closely with probation in juvenile hall and the regional facility. We have fantastic partnerships with education and a few projects through grants that we do with them. And then we have in our adult system, mental health diversion and jail behavioral health services. I wanted to just say that in response to COVID, we really have continued primarily all services throughout. We've certainly made modifications to what and how we've done those services. One of the things I think was significant is early on, we set up a warm line so that individuals who were simply struggling with anxiety or distress or disease about COVID had a place to call that wasn't quite at the level of crisis. We've also, modified and adjusted services, as many have, to do more telehealth or remote treatment. And we've made some changes to our facilities. We've made some modifications and requested flexibilities at the state level so that we could continue to bill and just strategized with partners about how to continue providing services. As COVID is kind of changing, lessening, we're certainly stepping some of those things back as appropriate. And we're continuing to kind of look at where modifications are still really valuable and helpful to us, and where going back to more in-person is needed. So that's kind of an overview. I just want to reiterate that we really do have the majority of what we're doing up and running. We welcome referrals, requests for services. I have contact information for all of our different programs, and I'm happy to share those with this group, or at some point have media send those out to this group. Thank you.
Thanks very much, Emmy. Michelle, can you share an update from Public Health?
Sure. Hi, good morning, everyone. Michelle Stevens, Public Health Director. I just wanted to kind of give a little bit of a look forward, a little bit, kind of what we're looking at currently and what we're looking at towards the future for public health in this response. We're still very much in the middle of this pandemic response. I think, we're all feeling really hopeful that vaccine is here and that we're getting shots in arms. It's certainly something that we've all been waiting for. Those of us that have been in this response, especially. But we're not through this yet. We're still seeing cases. We're still seeing hospitalizations. So that's an important point. But we're also looking at kind of what does this look like for us as public health and in our response as a county. In the beginning of the response, we activated our Department Operations Center in Public Health. It's part of the ICS structure. And then once the response needed to grow and expand and scale up, we implemented the JIC, or we activated the Joint Information Center, and from there, the Emergency Operations Center through the Sheriff's Office. So as the response is kind of focused more on vaccine distribution and getting shots in arms, we're scaling back to a Department Operations Center starting July 1 is our target. And we're planning for what that looks like, what our structure looks like. Vaccine branch and the task force will still remain and whatnot, because we still have some work to do in terms of getting vaccine to folks. We have a communicable disease program in public health. It's a mandate that we have. It's been a long time underfunded. And so, communicable diseases, there are over 80 plus communicable diseases that are mandated to be reported to the public health department for follow-up and investigation. COVID-19 is one of those and will continue to be. We know that we'll continue to have COVID-19 cases, in the year, 2 years and ongoing. And so what is that going to look like for us as a health department? We're looking at our staffing needs ongoing as well. And the funding for that. I think that's something that the legislature and hopefully the community sees value in public health, and increased funding ongoing for local health departments is a need. We're seeing funding for COVID-19 response, and it's great, but we need continued funding for addressing the health disparities that we see, especially in communities of color in general, but also as we've seen with COVID-19 cases. So I wanted to share that there is a coalition called California Can't Wait with a $200 million budget proposal for fiscal year 21 and 22. for public health infrastructure and address equity and disparities that we continue to see across California. Yesterday, I was before the Senate Budget Committee, and we're really hopeful that it will get passed and that we can see some ongoing funding for public health. So that's kind of where we're at right now. Thanks.
Thanks, Michelle. Dr. Hoffman?
Hi, everyone. Ian Hoffman, Health Officer for Humboldt County. So I think we're all aware that we've been seeing a change in the tide over the last few weeks, shift in cases from, where we were seeing a downslope to now an upslope in cases, and, mostly a lot of them directly related to a large event, but not entirely. It's also, these cases are getting out into the community. We're seeing, spread among businesses and other organizations. So we know that we're, like Michelle said, that we're not out of this yet. We want to continue to encourage everyone to get tested, especially if you've been exposed to someone who is ill, or certainly if you've been exposed to someone who has COVID-19, or you've been to an event where people have COVID, have had COVID. We want to encourage people to participate in investigations. It's really important going forward that we continue to track this disease, because without our ability to know where it is in our community, it's very hard for us to stop it from spreading to the next group, the next organization, the next business. I want to encourage everyone to keep wearing a mask. It is the most important thing for us to do to stop the spread of COVID-19. And definitely want to encourage everyone to get vaccinated. This is the most powerful tool that we have in this pandemic to stop the spread of this disease. We are now at a point where we have vaccine. It's open to everyone who's 16 and older. We know there are certain barriers for some people to get to clinics. So we want to try to break down those barriers as much as possible. But as Lindsay said, there are many, many clinics available across the county right now, both through public health, through private medical offices, through many, many pharmacies that can be found on Vaccine Finder. And I want to kind of look forward to where we're going with this vaccine effort as well. We're headed into a time where the protections, public health protections that we've had throughout the whole pandemic are being taken away. So this stay-at-home orders that were very strict in the beginning have continually loosened and will continue to loosen over time. So those protections won't be there for people. And so the last protections that we're going to have are the vaccine and masking. So, really want to encourage everyone to get vaccinated. We know that in the coming weeks, we're going to see vaccination open up to 12 to 15-year-olds, which is going to be very helpful for getting us closer to vaccinating as many people in our community as want to get vaccinated. We know that the next group of age group is likely to come later in the late summer or fall, probably going to be two-year-olds and up, 2 to 12-year-olds. And we also know that the FDA is looking at removing the emergency use authorization and giving full approval for some of the vaccines that are now being used under emergency use authorization. And so all those things could be happening in the next few months. So please, keep an eye out for that. Just want to make sure that we're going to make sure that we continue to vaccinate and get the vaccine out there as much as we can. We're going to be continuing to do investigations as a public health branch well into the future. And this again can continue to participate, get tested, mask, and vaccinate. Thank you.
Thank you, Dr. Hoffman. Now we'll take questions from reporters. Let's start with Taylor from Redwood News.
All right, so the first question I have was, I know that in yesterday's press release and case report, you guys obviously put out that the county has accumulated 1 week of red metrics. And we know that it takes 2 weeks to move to a more restrictive tier. So I'm just kind of curious, what's the possibility of going back to red? And then what would this look like for Humboldt County, considering that we're just a little over a month away from the governor's full reopening date?
So great question. I've been in, well, our team here at Public Health has been in communication with the state team who oversees this, and asking these questions as well. So based on the numbers that we're seeing currently, it is likely that we will accumulate another week of red tier metric. What we're being told is depending on if things are stable in the community, the outbreak seems to be contained for the most part. Our hospital capacity is okay, and the hospitals are able to take care of the folks who are sick currently, that we would unlikely regress to a red tier metric or the red tier restrictions. So that's kind of what we're working with right now. We don't have hard and fast numbers. We hope that we don't have to get to that place, and I think that the real message to get out is that the way for us to get this under control is to test broadly, because we need to know where the cases are, to participate with the investigations, let our investigators know who you've been in contact with so they can place those people on quarantine and get them tested, and we can stop the spread of this new variant that's spreading in our community. Another question, just I'll put in there because it's probably going to come up anyway, is when might we go to yellow tier? And seeing that places like Los Angeles and San Francisco are moving to yellow tier, we need to be able to get this under control and get the cases down to go to yellow tier. Given the level of cases that we're seeing, I think that's many, many weeks away, but we could get there much faster if people were testing and if people were participating in investigations and following the current guidelines as we continue to vaccinate as many people as we can over the coming weeks until we get to June 15th.
And then just following up on that, is there any concern, considering I know you just talked about going to yellow, obviously everyone wants that, but with this governor's reopening date kind of so close, is there any concerns from public health that if, say, we do go back to red, that maybe the community just would kind of be like, who cares? It doesn't matter anymore. I mean, is there any concern for that? Something along those lines or that sentiment?
I think, yes, of course there's concern because we all have COVID fatigue, right? We're all tired of this response. We're tired of being cooped up in our homes and limiting our contact with friends and family and whatnot. And the light at the end of the tunnel has been vaccines. And so I think especially it's possible for folks that are vaccinated for sure, and people that are not vaccinated who might say, you know what, I can't do that anymore. But this is where I think we have to really think about the people that are the most vulnerable, that are still out there, that are getting really sick. And, we reported at the Board of Supervisors meeting yesterday that there are kids that are getting COVID-19, these variants that are getting sicker than they were previously. So I would hope that we don't go to the red tier. I think that I think the state is also trying to work with counties, and the vaccine is the way that we prevent more restrictions happening in California that would impact our economy. So, but yes, of course, there's a concern that the community just wouldn't want to follow those restrictions. It's understandable.
Thank you. Those are all the questions I had on that topic.
Thanks, Taylor. Does anyone else, do any other reporters have questions about tier assignments?
I do, if you don't mind, Mariah Riley.
Of course. Yeah, thanks, Riley.
Thank you so much. So with the tier assignment, we see obviously like San Francisco and Los Angeles, these huge areas that are able to move into a less restrictive tier. What are some of the practical factors that are not allowing a place like Humboldt with a smaller population size, perhaps theoretically an easier chance at managing this? Is it a geographic thing, socioeconomic? Like what are some of the practical factors that we're not able to control it the way that larger counties are?
Well, I think if you look back at the history throughout the pandemic, our numbers have been much better than most of those counties. Certainly much better than Southern California, Los Angeles, who had very high case numbers throughout the surge. So, the things that help us control this are testing, participation in investigations, masking, and avoiding large gatherings. And I think that's what we need to get this back under control and get us back towards yellow tier metric.
Thank you.
Any other questions about tier assignments? All right, we'll move on to Iridian from the North Coast Journal.
Hi there. So I have a question about vaccination efforts in the Latino and Latinx community. And I was just wondering what's being done with vaccination efforts in that community. And, is public health meeting folks where they are, whether that's working through providers or setting up a smaller mobile clinics like in front of mercados like El Buen Gusto and yeah.
Thanks, Lindsay.
Hi, this is Lindsay again. So we are doing a great amount of effort to meet people where they are, regardless of any backgrounds. Right now with the Latinx community, we've been working very hard to have bilingual persons and bicultural persons at the clinic. And with the mobile team specifically, we would like to have anybody who has ideas for how we are going to utilize the mobile clinic to please send it through email or call the JIC so that we can add it to our rotations in the future. In this whole effort that we've been doing with mass faxes and with primary care providers, we have been trying to ask the primary care providers who serve the Latinx community in greater numbers to help us participate in these larger clinics. We've asked that they promote the mass vaxes that are going on in Arcata and at College of the Redwoods when they have been there. And we recently did a very wonderful vaccination effort at Fortuna High School, and we will be in Rio Dell on Thursday. And this has been mostly based on the fact that we would really like to even have more promotion in the Latinx community and meet them in their locations, at their work, and respect the timing of when they would like to receive the vaccine. And if there's any ideas of how we can serve better, we would like to know.
Yeah, and I just want to add in, thank you for that, Lindsay. That was great. Want to add that we're doing all this as a county health branch, and trying to build this out as we do it. So it's a work in progress. We've gone from these large mass vaccination sites where the focus is really just get as many people through the line as quickly as possible to more focused, targeted outreach. And it was very difficult for us to do both at the same time. We would have loved to, but it was, just not possible. So what we did do some targeted outreach through larger businesses back in February and March to try to reach groups that had a larger Spanish-speaking population. As Lindsay mentioned, working through larger providers who work with the Latinx or Spanish-speaking population, such as Open Door, being one of the biggest providers in the county, and trying to leverage that aspect. And so I think as well as trying to leverage our community partners through the Promotores and the Latino network that, to get the word out, to encourage people to get vaccinations. So I think what we're seeing is a combination of both the supply side issues of where, it was difficult to meet all the needs of the community. And then also, just these barriers that exist, such as, people having to work 7 days a week, and it's really hard for them to get to clinics, and it's difficult for us to meet every single person in the county at their place of residence or place of work. So that's what we're working towards in the coming months, to really just do as much mobile outreach as possible and try to get to all those pockets and get the word out that we want to do that. We want to come out as much as we can and get as many people vaccinated until everyone has a chance to get a shot.
I just want to add that we have a partnership with Centro del Pueblo as well, to produce educational videos in Spanish around not just the promoting vaccine, but also wearing a mask, washing your hands, doing things like that, passing out hand sanitizer. So it's another organization that we're partnering with to try to speak directly to the Latinx population around promoting all the prevention measures and vaccine. And then as we continue to plan for these mobile clinics that we're doing, which we know is going to be moving more into mobile vaccines and seeing less numbers in the fixed site necessarily in Eureka, but getting out in the community more. What we do is we try to tailor it to the community that we're targeting, right? And so we'll continue to do that. We had the clinic that was in Fortuna recently, and so we'll continue to go around the county and find folks that want vaccine that have had difficulty accessing it, and that'll be the Latinx community as well.
And I also want to point out one other thing is that the JIC has Spanish-speaking folks there who can answer questions, who can help find vaccine appointments, who can point people in the, to information that they're looking for, whether it's on vaccine or testing or just general questions about COVID. And so, please want to make sure that we promote that phone number 441-5000 among the Spanish-speaking community, because it's a resource for all of us and all of Humboldt. And I think, the more we can get that out there, I know, they are starting to get calls now from Spanish speakers, which is great. And we want more of that. We'd love to have, those folks, busy answering questions all day long and hooking people up with vaccine appointments.
Any follow-ups, Iridian?
Yeah, I was wondering if there are any measures county or city governments could take to aid in those vaccine efforts. Like, for example, passing ordinances requiring employers to give employees time off work to get vaccinated, or whether there are ways local governments can help the vaccination effort in that way.
Yeah, I would say anything like that would be well appreciated, both at a jurisdictional level or even a private business level. We've been encouraging businesses to give their employees time off, allow them to take the day off after the vaccine if they need to, incentivize vaccination as much as possible. So we would definitely support anything like that.
Any other questions on that topic, Iridian?
Yeah, is there like a way that public health could, I don't know, maybe go to like the Board of Supervisors with this ordinance or type thing to actually really incentivize it at like a government level?
Well, I would say that the Board of Supervisors the jurisdiction is the unincorporated areas. And so I don't know that, we would want to reach out like we have and met with city managers and city council folks and whatnot regarding those jurisdictions. I don't know that the County Board of Supervisors, I'm curious about that. I'd have to look into that a little bit about what it looks like for a County Board of Supervisors to institute an ordinance requiring the businesses allow for and pay people or provide the time off for folks to get a vaccine. That's something that we would have to look into.
Okay, thank you. Those are my questions.
Do any other reporters have follow-up questions about outreach to the Latinx community or streamlining the process of getting time off for vaccination? All right, we'll move on to Lauren Schmidt from KMUD. Thanks for joining us, Lauren.
Thank you so much. Yesterday's Humboldt Health Alert stated that our county's adjusted case rate is the second highest out of California's 58 counties. Can you share insight as to why that is? And is it directly related to the super spreader events?
Yeah, I think what we're seeing right now is a new variant that's moved into Humboldt County, the B117 or UK variant, and we know that it's more contagious. It's likely been spreading here in Humboldt since late March or early April. There were large events that likely helped that spread, but it is not isolated entirely to that event. We know that it's happening in business places, organizations, other gatherings that were not related to the original super spreader event. So it's out there, and I think the only way for us to really contain it at this point is to test broadly. So again, I want to encourage everyone to just get out there and get a test. We have plenty of tests available to continue to follow the CDPH and CDC guidelines around masking and distancing and gatherings, especially household gatherings. I think that that's a really big place that we see a lot of spread. And also following the CDPH guidelines around public places, so masking in public places and capacity and following all those rules that are still in place under the blueprint currently. And then lastly, the biggest thing that we can all do is just go out and get vaccinated, because we know that vaccinated folks are, not getting sick. They're not getting, having to take time off of work. They're not having to quarantine. So they're having less impact on society, less impact on their families, and they're not likely to spread this to other people.
Thank you. One quick follow-up with that. Is masking still effective against the variant? And during the super spreader event, particularly at the Eureka Church, were all of the individuals wearing masks indoors?
Masks are extraordinarily effective against all of the variants. And so all of the things we've been doing all along will prevent the spread of this. So masking, distancing, capacity limits, and vaccination. I think when you're in a setting without a mask on, that's when that, what we know is that it's likely 50% more contagious. So it just means that it's that much more likely that you will get it when you're in that setting with other people who are unvaccinated without your mask on. And I cannot speak to whether people had masks on or not in the Eureka Pentecostal Church. I think you need to ask folks who were there. We have not heard.
Thank you.
Any follow-ups on that topic? All right, Riley from North Coast News.
Thank you. Quickly just wanted to start with a clarification question. Dr. Hoffman, earlier you mentioned that the vaccine was going to be getting full approval as opposed to the current emergency use authorization, hopefully in the future. What is the difference between those two designations?
That's a great question, Riley. So what emergency use authorization means that we really can only use it in these very select settings. So that's one of the restrictions that has been placed on us, that it makes it difficult. You know, we can't have it in every office and every pharmacy. It's only approved providers. What the full FDA approval will mean is that, you know, the vaccine manufacturers can market it directly to every pharmacy, every office in the country, and that they can market it directly to consumers, so they can start to put out their own information that wouldn't come directly from, you know, the health departments across the country. So, you know, I think the other thing is for us as public health, it doesn't change anything. We know this is safe. We know this is effective. We know it's something that we are encouraging our own, you know, ourselves, our families, our coworkers to get, our community to get. So we feel strongly about it. But I think it might give some people who are hesitant that extra level of assurance that this has met all of the hurdles, you know, that a approved medication or treatment has to go through to get FDA approval. So it's just that last hurdle to get full approval.
And do you think that there will be an increase in vaccination uptake after the full approval is met? You mentioned maybe a little bit more assurance from people that perhaps were hesitant.
I don't know. I think there are some thoughts that could be one of the things people are looking at. Certainly it would encourage people not to wait for that approval, but certainly I'm hopeful that we can get that approval as soon as possible, in case that is a factor in some people's minds.
Great, thank you. And then Ms. Mendez, you mentioned earlier that there was a bit of a shipment issue with vaccines this week. Do you currently have enough vaccines to meet the predicted demand at the Rio Del MassVac clinic tomorrow?
Yes, we do. We are currently sorting out the vaccine shipping issue as we are being interviewed right now. The team that is not on this live call is actually working very diligently to get the vaccine, the appropriate amount, into our county today. Essentially, during this transition, I will go into this, during this transition with Blue Shield, I'd like everyone to know that nothing is ever perfect when you're transitioning with a third party administrator. And obviously Blue Shield has been taking over the allocating and shipping of this vaccine process. And they are still working out many kinks of how this is moving forward with all the local health jurisdictions in California. And we are hoping that this will not continue to happen, these glitches, but we are prepared. And that's why our amazing EOC and Public Health Task Force is fixing the problem right now.
Great, thank you. And just one more question, if you don't mind. Broadly speaking, as other counties are able to move into less restrictive tiers and open up a little bit more with people traveling in and out of the county, are there any concerns as people begin to move more freely around the state?
I think, yeah, there's definitely concern with the variants that are out there. We know that, you know, now we have UK variant being the predominant one. That could change in the future. I think that as long as we have an unvaccinated population here, we have a population that could, you know, contract COVID-19 and then pass it on to others. So, but if everyone's following the public health directives from the state, I don't think there should be much of a concern. I think that just as they've been all along, they're there to protect us. And, you know, the measures that we're loosening right now are based on the fact that we do have 50% of the eligible population in Humboldt County has at least one shot, and approaching, you know, 40% of that population that is fully vaccinated. So, you know, that's something that is protective, and, you know, it's replacing the measures that required us all to stay at home. So, you know, the concern is for those folks who are vulnerable, who, you know, who have higher risk for the the disease and haven't had a chance to get vaccinated at this point. So we want to make sure that we protect those folks, and especially our children and our youth, and who won't have a chance to get vaccinated for many more months to come. So we're going to need to continue to think about the kids going forward, and how to continue to protect them until we can get them vaccinated, those who want to get vaccinated.
Thank you very much. No further questions. I appreciate your time.
Thanks, Riley. Isabella Vanderheiden from the Times Standard. Thanks for joining us.
Hi, good morning. Thank you for pronouncing my last name right. So my question is actually in regards to herd immunity. So this week, we've seen reports stating that it is unlikely that the United States will be able to reach herd immunity. So I think we've kind of touched on this before, but what percentage of Humboldt County residents need to be vaccinated to reach herd immunity here?
Herd immunity is really something that we only know the true number in retrospect, because this is a brand new disease. We are learning about it as we go along. So it's very difficult for us to put a specific number for COVID-19 and what would lead to herd immunity. So what I think is the public health approach right now is the more the better. The more people we can vaccinate, the better off we're going to be with this disease. And so we're just going to keep striving for the highest percentage that we can get out there. There were encouraging signs of, for our state and for our county. A New York Times poll that was published yesterday showed California having one of the highest acceptance rates in the country for the vaccine, and actually Humboldt County was very high on that list of counties for for the state of California. So I think what that's going to look like as we break down these barriers that we know do exist, because we're a rural county. It's hard for people to get to places. There are issues with transportation, work schedules, childcare. I mean, the list goes on of the kinds of barriers that are there for people to get to vaccine appointments. So it'll be, I think really important for us to recognize all those barriers and get it out to as many people as who want it in Humboldt County.
Thank you. And so if we do not reach, quote unquote herd immunity, it seems as though there is, increased potential for more variants to develop, and subsequently more potential for the vaccine to be, potentially less effective on those variants. Can you just kind of elaborate on that?
Yeah, I think, we haven't seen variants yet that are truly evading the vaccine response. It is a concern that, is there theoretically. We do know that every opportunity this virus has to replicate is a chance for it to mutate and get around some defense that was there previously. We will. That's one of the reasons we're doing all this genomic sequencing of this virus. Soon we'll be able to sequence here in our own county. We're getting that hopefully set up by the end of this month, early part of next month. So that's going to be a great help. And I think the genomic sequencing across the country is ramping up as well. So we'll keep a close eye on things. I think my bigger concern is really for the unvaccinated population, just continuing to have the devastating effects of being hospitalized, being in the ICU, seeing multiple people in a family hospitalized at the same time in the ICU it's just something that we shouldn't have to see, and we can prevent it through these public health interventions, and especially through vaccination. So we hope that people just start breaking down the barriers and getting to vaccine appointments, and getting everyone in Humboldt who wants a vaccine to get one.
Thank you. And I do have one more question sort of on the subject of the variant. So during yesterday's supervisors meeting, you had spoken about how, this variant, the UK variant, has led to a spike in hospitalizations and also in kids. And I believe you had said 20 to 30% of our local cases are in people under the age of 16, which only comprised 2 to 3% of positive cases previously. So we did get a couple of questions from our readers about that. So can you just kind of further explain that percentage and also talk about how many like actual kids have been affected?
Yeah, so the some of those percentages we're quoting were from national statistics. So the shift over the last really 4 to 6 weeks has been that as we are vaccinating the older adult population, we are seeing a lot more cases in kids. And so early on in the pandemic, nationwide and both statewide and locally, really seeing very few cases in kids, around the low, 1, 2, 3% range. And nationwide, that shift has been a big increase. So again, around 20 to 30% across the country, we're seeing in that younger age group, less than 19 or 20. And I think on our dashboard, we break it down into 0 to 10 and then 10 to 20 age groups. So I don't have specific numbers on the number of kids, but I do know we reported out earlier in the week that it's comprised, that younger age group is really comprised about, I think it was roughly 22% of our cases. So that shift that you're seeing nationally is something that's also happening here locally. And I think the main point, and Michelle also talked to this, is that we are seeing kids sicker, not necessarily a huge spike in hospitalizations, but we did have our first hospitalization in a younger person in the last few weeks with this UK variant. And we just are seeing, in the past when we had cases with kids, they were asymptomatic or very mild, runny nose. But in this case, people are getting much sicker. They're getting higher fevers. They're getting more cough and shortness of breath in a younger population. So that's something that we are seeing and trying to track. And as we get more information, we can try to report on that and give look at some of the statistics.
Thank you very much.
So we have fewer than 10 minutes left. I'll run back through the reporters and just see if you have maybe one additional question, and we have time for a brief answer. So Taylor from Redwood News, any more questions? And do you have another question?
Yeah, I just have a quick one. So I know that there's been a lot of talk about vaccine passports, and I know that there are live event guidance that capacity can increase if people are fully vaccinated. And so I'm just curious, as health officials, this is a more general question, but just why do you guys think that there seems to be so much pushback against kind of vaccine passports or vaccine certification? And then is this something that's been observed locally?
We don't have any local plan for local vaccine passport. We're definitely working with a lot of event coordinators and different groups across the county and letting them know about the CDPH guidelines around increased capacity for events that have fully vaccinated status or a mixture of vaccination and testing. The way people are going to verify that is it's really up to the event coordinators to do that. Mostly probably people's vaccine card or a proof from their doctor or a printout that has their vaccine dates or status on them. I know there are private companies looking at creating these sort of vaccination passport or vaccination wallets, and that might be something that people will look into as well, but we're not supporting any specific vaccine passport locally.
Iridian, North Coast Journal.
Yeah, so this may be a question for Emmy, and I was just kind of wondering if she's seen, or I guess if she's seen an uptick or downtick in behavioral health responses to teenagers and kids in school and stuff like that.
Yeah, thanks for the question. Really what we're seeing is that children have such varied responses to COVID and to the impacts of it. And so, when everybody went home, there were some kids that was just devastating to, and others that felt really comfortable with that. And so as we're having kids return to school, we're seeing similar things. There are certainly some kids that are showing more kind of anxiety and depression and crisis type symptoms. We're also having more eyes on kids now that they're back in school. And so it's easier to kind of flag those issues. And then there are some kids who are just really relieved to be back in school for all the reasons that this group already knows, that they're reconnecting with peers, they're able to do the activities that they want to be doing, joining sports, so that type of thing.
Thank you.
Thank you. Lauren, KMUN News.
Thank you so much. Yeah, this is also for either Michelle or Emmy. Can you just share a quick update on the unintended consequences regarding the pandemic, such as increase in drug use, overdoses, and maybe an increase in other communicable diseases?
I can just say briefly related to drug use, we've absolutely seen an uptick in drug use over the course of the pandemic. And I think accidental deaths due to drug use. We've also had more individuals seeking services related to drug use, which I think is indicative of the challenge in the communities.
I would just add that, I think you've probably reported on and read a lot about the consequences that communities of color are seeing in terms of COVID-19 and the impact in those communities. But really, we've been seeing disparities in health outcomes in communities of color for a long time. And so that's what we've been working on in public health across the nation and across the state and here in Humboldt, is how do we address those, right? How do we look at the social determinants of health that really impact communities? Things like poverty. Rural communities like ours experience health outcomes just like we do here in rural Humboldt. So I think, the unintended consequences is it's magnified and it's more people being impacted by that. Our economic impact has been huge, not just for small businesses, but for working families and losing employment or not being able to work. So it's been really hard for everybody.
Thank you.
Thanks, Lauren. Riley, North Coast News.
I don't have any further questions. Thank you.
Thank you, Riley. Isabella from the Times Standard.
Hi, yeah, I would just ask, I know in the last few weeks, month or so, we've seen a decrease in, vaccinations, seeing that vacancies at vaccination clinics. Are we seeing any improvement there?
I think, yeah, there were really encouraging signs with our mobile outreach that Lindsay mentioned. All of these smaller clinics that we're taking out to communities are filling up pretty rapidly. And in fact, many of them we've had to expand. We weren't sure what the capacity was going to be, or what the demand was going to be. We thought it might be lower, and then, they'd fill up in a day or two. So we'd expand them, once we saw that. So I think that's a really encouraging sign. It also means there's a lot of hard work ahead.
Thanks very much. Oh, I'm sorry to cut you off there, Isabella. We're inside of 2 minutes. So thanks very much to the reporters for participating. I wanted to give the panelists an opportunity to share any closing thoughts. And if maybe you wanted to share what vaccine or the availability of the vaccine has meant for your agency or you personally. Let's start with Dr. Hoffman. Yeah, thank you everyone for being here. And,
the vaccination effort has been a challenge. It's also been tremendously uplifting to see, I think we've all seen people who walk out of vaccine clinics in tears of joy. So that's, I think that's what it means to me, is to be able to, as a physician, provide a life-saving medication to patients who want it. And we will continue to do that until every last person in Humboldt County has an opportunity to get vaccinated. Thank you.
Thanks, Dr. Hoffman. Emmy?
Hi, sure. I think thinking from the behavioral health perspective, behavioral health really are essential services, and sometimes that gets lost in thinking about kind of the medical impact of COVID. And so behavioral health service providers are struggling with all the challenges and anxiety and worries that the rest of the community is struggling with related to COVID. So the opportunity to have vaccination, I think, really is kind of reassuring and allows for more comfort and confidence for them in providing those services. So it's really been, I think, extraordinarily helpful for behavioral health to be able to be vaccinated.
Thanks, Emmy. Michelle?
Well, I certainly never expected to experience a global pandemic in my entire career. So when early on in this, when we were trying to determine what is this going to look like, when are we going to get out of this, and what does getting out of this actually mean, we knew that the vaccine would really be the path out and the path to recovery for everybody. So to finally have the vaccine here was certainly hopeful and exciting. And I have to say that it worries me that there is so much misinformation out there about the vaccines, and therefore, as a result, vaccine hesitancy for folks. There's a lot of information on the CDC website regarding vaccines, CDPH. There's a lot of very credible information out there if folks have questions or concerns. And, I think we need to rely on that information and in our decision making. And I would just really encourage everybody to if you're on the fence and you're not sure, figure out what your questions are, and we can get you some answers so that you can make an informed decision, because this is the thing that helps keep our community safe. And we're going to continue to see COVID-19 cases. It's here to stay. We're going to get through it, and we just want to continue to save lives and prevent severe disease. And vaccine is the way that we do that, just like we did with polio, just like we do that with measles, just like we did that with a lot of communicable diseases that we don't see anymore. So I feel hopeful, to be honest. Yeah.
Thanks, Michelle. Lindsay?
Hi, thank you. When I think about what the vaccine has done, I think specifically with my position and my job, when the vaccine finally hit our county, I just will remember forever the amount of people in interdisciplinary studies who came together, just different jobs, different outcomes of their jobs, different positions, different skills, because of the excitement and knowing that this vaccine can end the pandemic, and just the amount of drive that everybody has had, that they were going to get shots in arms as fast as possible, so that no matter what you want in your life, no matter what makes you happy, we want to go back to doing it, right? And just acknowledging that we can all come together and work in many different fields to end this pandemic, whether it be a person who manages at a farm and says, I want my employees vaccinated, right? To a person like we were talking about before with helping people get off of work, right? To anybody, a boss that allows somebody to go get a vaccine because they think that this is very important. I cannot stress it enough how amazing it is, and that we should continue this effort as long as we can with as many people as possible to get as many shots into arms as we end this pandemic. And I think that we can all agree that this has been both challenging but enlightening. Thank you.
Thank you very much to our panelists and our media representatives. My apologies for running over. Have a great day.